means, of course, here at Sonoran Living, we along with Mayo Clinic, we are committed to your heart health. And today, we want to talk to those of you who have already been diagnosed with heart failure. There is an opportunity for you to learn about some really new clinical trials and research studies that you may want to benefit from. Dr. David Fortune, he is of Mayo Clinic. He's a cardiologist there, and he's here to explain who might be a good candidate for these trials. Great to see you. How prevalent is heart failure in the U.S. right now?
It's really common. Almost 6 million people in the U.S. have heart failure.
6 million people. And you were saying once someone's diagnosed with heart failure, in a matter of how many years do a lot of them pass away?
Well, so 50% at 5 years are dead, which is an amazing statistic.
That is a tough statistic. Are there symptoms that we can look for, Dr. Fortune, that maybe if we're watching this morning, because I know we're talking about those who've already been diagnosed, but are there symptoms that we should be watching for that we may say, we need to see a doctor?
Yeah, I think if you are unable to do what you were doing before, for instance, you might develop shortness of breath when walking or going upstairs, certainly swelling in your feet. Those are some of the more common symptoms that could be a sign of heart failure.
Right, and what types of treatments are you currently recommending for those who do come in to see you with heart failure?
So it really depends on what the underlying cause is, but almost everybody should have a sensible diet and exercise. I think that's really important. Then we have a whole host of medications that are really effective. And for heart failure.
And then stents and bypass surgery, these are things that people are currently doing, right?
That's right.
That come in to see you. And you're looking for people, and I know you're very excited about this. You want them to participate in some clinical trials there at Mayo. What's going to happen to them during those trials, and who is a good candidate? Who should sign up for these trials?
Right, so we're looking for people that have exhausted the usual therapies. So they've tried the diet and exercise, they have had bypass or are not candidates for bypass, the valves are fine, and we're looking for people that still want a better quality of life. So we're specifically looking at stem cell
Okay, so
therapy.
We're looking at this is a graphic of an abnormal heart. So how can you tell that when you look at this?
It's not a video, huh?
No, it's actually just going to be, I mean, can you look?
So this is an ultrasound image,
okay.
And these are usually videos, which you see on the show before, but this is the chamber of the left ventricle, the pumping chamber of the heart, and it really doesn't contract as vigorously as a normal heart contracts. And so what happens is you can't augment your cardiac output, so when you're walking, your heart just can't keep up to the needs of your muscles.
Right, and we're looking at a normal heart image, and not the video, but an image. And so these are folks who come in for these trials. These are folks who already have been diagnosed with heart failure, and it doesn't matter how long that diagnosis. It could be 1 year, 2 years, 3 years. You want them to come in. What will happen during these trials? What specifically are you looking for?
So we'll have them talk to one of the research coordinators, and then we'll see if they are truly a candidate. We have a host of inclusion and exclusion criteria, and so we want to make sure that, first of all the conventional therapies have been tried and are ineffective, because you don't want to go and research if there's something that we know works, obviously. And so once we determine that, then we see if you meet the criteria for any specific trial that we may have to offer.
And it doesn't matter age. I mean, just really come in and see if you are a good candidate. And tell us about the Center for Regenerative Medicine and what the goal of that center is at Mayo.
Right. So that's a foundation-wide center, and really looking at novel ways to improve the body. And stem cells is a great topic, because the whole idea is that you're not taking a pill, you're not getting a device, you're using your own cells or someone else's cells to help the body repair itself.
Right, and that's really the wave of the future. A lot of people are going into stem cell therapy, and it's specifically for the heart.
Well, the heart, the brain, muscle, everything. Yeah, exactly.
And when you're talking about those stats that you said off the top, 50% of folks after 5 years, those are tough statistics. Well, thank you so much for your time. We appreciate you. Let's give you some information. We only, of course, can scratch the surface on segments like this. So if you have questions, maybe experiencing some of the symptoms Dr. Fortune was talking about, and you want to know if you would be a good candidate for these clinical trials, you can call Barb Knight. The number is 480-342 2545. And of course, lots of great information always available to you at mayoclinic.org. And don't forget, ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign. Each month, we give you easy to follow recipes and ideas to help you and your loved ones live heart healthy. To learn more or to get our Rally for Red reminders, please sign up at abc15.com/rally for red.